everyone. Jill Nixon here, staff. Before we get started, I want to give you all an opportunity to elect someone to vice chair the meeting today. Since Barry's stepping back or from that, you guys want to do that, or do you want me to just go through everything?
Jill, I can start, but I do have to leave a little bit early because I've got another meeting at 2:15.
Okay, great. Thank you, Raylene.
So since we have a quorum, it is June 12th, 2024. It is 1:03 in the afternoon. And this is the Incarceration Prevention and Reduction Task Force Steering Committee. I can begin with the land acknowledgement statement. Jill, could you bring, thank you, perfect. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. So I believe we are called to order. And first thing on the agenda is the annual report.
Thank you, Raylene. I wanted to just let you guys know that this is the last opportunity before it goes to the full task force for review and approval at its meeting on the 24th. So if you all want to go through it, I'm happy to do that. Or you can email me any suggested edits by, I would say, the end of the day tomorrow. I did email around today some suggested edits from Perry, so that's in your email box as well. So is there anyone who has any comments or feedback?
Jill, I've got a question for you.
Sure.
Let's see, is it possible, I've run into a scheduling thing. I need to be gone tomorrow and wanted to go through everything one more time. Is it possible that I might have until end of day Friday?
No, because I need to get the packet out to the task force on Friday. I'm out of the office next week. So can you get it to me by Friday, say midday, by noon?
Yes, I'll make sure I do.
Okay. And then if you have additional edits, Peter, feel free to bring those in writing to the task force meeting.
Oh, okay.
And you can make amendments at that time as well.
Okay, very good. Thank you.
Sure. Dan?
Yeah, I just wanted to ask Perry about the edit in the first, or I'm sorry, the I guess it would be the paragraph that's under the table, the edit talking about transport. Can you just, Perry, can you just elaborate a little bit on that and what that's looking like?
Sure. A couple of things that I think that I've mentioned before, that Response Systems Division has hired a behavioral health aide that provides transportation for a number of individuals that are in need of, making it to appointments, that sort of thing that are behavioral health involved. So serves the Crisis Stabilization Center as well as the GRACE lead teams. Mental health court will commonly use this individual as well. And additionally, are in communication with the providers relative to really two things. One, the absolute necessity to not be calling law enforcement to transport an individual if an admission is not possible. I don't think that that's happening anymore, but it was in 2003 and of course, or 23, sorry. That's what we were making reference to. So I believe that we've addressed that in addition to creating a flex fund for the providers that they could use cab, those kinds of things. We're a little more cautious about that because a person may be in need of more support than a cab driver, would be able to provide, ergo the behavioral health aid that is in place at this point, has been hired and is actually doing transport at this point. Other information I can provide, Dan?
Where does the funding come from?
Boy, that's a great question. I don't want to speak out of turn here. I'm not absolutely certain. I believe that the funding came through the Behavioral Health Program Fund, but I'm not absolutely certain of that for that position.
Is that the 1/10 of 1% that was passed in the mid 2000s?
Indeed, it was actually, I believe, passed in 2015.
Okay.
But again, I may be speaking out of turn here. I'm not absolutely certain, in regards to staff, and that funding. I can find that information out though and provide it to you.
Okay, thank you.
Any other questions or comments about the annual report?
I have one,
Sure.
if folks are looking at that in that same paragraph, I wasn't sure how folks felt, if they felt the same way I did. At the end of the paragraph, it's at the bottom of the page. It states, however, the EMTs and paramedics tell the patients to leave their medication, et cetera, et cetera. What I was getting to was the statement that the Whatcom County Fire Chiefs don't have confidence in the facilities, so they have not created protocols. I was just concerned about, I don't know where the statement, specifically came. I don't recall that in that particular meeting. Do we want to specify that? Do we want that statement in there relative to the Whatcom County Fire Chiefs? Not as much, well, in terms of the fact that they haven't developed protocols relative to a lack of confidence. Again, if it's accurate, so be it. I just wanted to be cautious about wording and etc.
Yeah, whether or not you all want that statement in there is not up to me. I will say though that it is a statement that was made during an open public meeting. So it is accurate. At least it was accurate as stated during the meeting.
Okay, so that's helpful, in clarification for me. I did recommend in my version that the statement that confusion and frustration resulting in feelings of friction between law enforcement, first responders, and facility staff. I think that is concerning to make reference to the frustration, et cetera, for facility staff or the providers. So I wanted to offer that comment. I didn't know if it was helpful, in regards to this report, but I just wanted to bring it to folks' attention.
Yeah, thank you, Perry. I think you were absent from the last steering committee, but I was asked at that meeting to make some changes to your submission here to really more accurately reflect the conversation that was happening at that time. And so I'll leave it up to you and the committee to decide what of these changes to keep or to make any other edits. Either way, it's fine with me. It's just really up to the steering committee.
Harry, just a thought on that. I don't know if it's that. I mean, I know that there was concerns about law enforcement and EMS and the facilities, and I don't know if maybe we could find another word other than friction, because I think there was concern that law enforcement and EMS didn't feel like they could use the facilities the way that the intention was made for drop off on involuntary, but knowing that there's licensing issues that the facility staff can't go hands-on with somebody, they can't meet those required needs, that's where there's, I don't know if friction's the right word. Maybe we could come up with a better way to communicate that, because I think, there's things that they need, law enforcement and EMS need, and that's some of the things that Andy Deacon Center can't meet, and the facilities know that, or the people that work there know that. And so I think there's frustration that they can't meet all of the needs based on licensing issues.
Yeah, I really appreciate that, Raylene. And I think it was really friction, just sort of making reference to the fact that there's friction, frustration for sure. And your point is well taken. I was more concerned about using the term friction and just wanted to, again, bring it to folks' attention.
What if we say, this confusion results in feelings of frustration? Is that, um,
I'm seeing heads nodded.
I don't see a huge difference between them myself, but I'd have to review the tape, but I think that both words could describe what I heard.
are there
Just
any
want to be
other
accurate.
comments or edits, suggested edits?
I don't have any further edits, but I think the frustration or whatever we're calling this goes well beyond our first responders and exists within policy making. This was not the expectation that we had when we spent years to develop this center. So I'll leave it at that. But I'm a little bit beyond frustrated when I talk to our first responders who are having difficulties using this very, very expensive resource. And they're not being successful, and the patients aren't being as successful. So we have a lot of work to do on this, and I'll circle back and bring this up as a new agenda item at a later meeting.
I see Sat Paul's hand is up.
Yeah. While we're at it, I just wanted to understand that a little more. It says Whatcom County Fire Chiefs don't have confidence in the facility. Like, where that come from? How we can eliminate that? Like, this facility has been in operation for a while now, more than 2 years. And like, what makes them feel they don't have confidence in the facility? Like, what parts of the facility? People, or physical facility, or their interaction? I think it's quite a strong statement here that that's why they don't want to change their protocol, because they don't have no confidence in the facility.
Well, I think what we heard pretty clearly, Sad Paul, was that, in my memory, is that they are unable to do drop-offs in the way that this facility was supposed to work, the way it was advertised, if you will. And it's been a great source of frustration for them and friction, and both. And I would say that also there's been, let's see, the idea was that they were going to be able to, we would be able to have 12-hour holds. Those issues have never been ironed out. They've come up in a recent meeting, I believe it was in the Legal and Justice Committee meeting. There are ways to move forward with that, but we have not convened the right people in the right rooms to make that happen. I think those are the two big issues that I've heard.
I think that we should really take some efforts to resolve this, right? Like, we can't keep going on like 2 years we have gone like this. Like, what are the 2 or 3 important people? And maybe over contract is Compass Health, and the other people, I forget their name, and if they have to be in one room, and or their bosses, let's solve it, like, figure it out.
So I think something that's came up is the licensing and the facilities, the way it was built does not allow for a person that's got a 12-hour hold on them that they can walk away from the facilities. And they also can't go hands-on in that facilities. And because of that, law enforcement and EMS often end up with individuals that are combative and don't meet the requirements that facilities is licensed to hold. And unless we can change the licensing or the requirements met for that, I mean, the facilities is still being used. And we see that it's being utilized. The frustration is that it's not being used for the intended purposes that we were hoping it to achieve. Because currently law enforcement and EMS can't do that involuntary drop off.
No, really, my question would be that, is it like 90% of the people this is happening, or is it 10% of the people that's happening? The way the statement is that the two don't get along, you know, for lack of my clarity or choice of words, right? I think that we can let a little bit define that in case of certain, which are happens like 10% of the time, I'm just picking a number, that there are some difficulties between the two handover and takeover process. But like writing that work chiefs don't have confidence in the facility, it just puts the whole facility in that light.
I can, if I can suggest a change that might help with that, executives to do, I could say something like the fire chiefs don't have confidence in their ability to use the facility.
Well, it's still the same. I think they don't want to use the facility. I mean, we spent $15 million and we are paying millions of dollars a year to run this, and the very users of this say we don't have confidence. I think we need to talk to chiefs also, and somebody has to bend a little bit here, you know, that they can create a protocol to make it work, rather than saying, okay, you know, me or no other way. I mean, I don't know that which we need to work on, or how many times, like how many cases. I think that, I don't know, maybe you guys, I don't get too involved in that, so I don't have firsthand knowledge, but what I'm seeing, it is a blanket statement on the facility from the fire chiefs that you built it, but it's useless.
Barry, I know you've discussed it before on the licensing need. I thought there was structural requirements too for meeting the hands-on, or is it just licensing?
No, there's a couple of items that are, I think, an issue. You know, I'm interpreting a little bit in terms of the lack of confidence in terms of the fire chiefs. One of them is RCW 1031-110 allows for a 12-hour law enforcement holds. So it's general legislation that allows for that. It specifies a number of steps and so forth. But one of the things that it also includes is that the prosecutor's office has to work with the law enforcement to identify the charges that would be allowable to be considered for the alternative of, you know, diversion, obviously, for a 12-hour hold. Concerns, as Raylene had stated from law enforcement, as I understand it, is that because it is not an involuntary facility, the staff are not licensed and are not allowed to go hands-on by virtue of their licensure, so they could not stop an individual that chose to leave. What they can do is that they can make contact with that law enforcement office, inform that office that the individual, you know, has chosen to leave before the 12-hour period of time. And so they do have that obligation as well. There are concerns, in my understanding, from the prosecutor's office that there are liabilities of taking an individual, that diverting the individual in that given situation, and the advisement from county attorneys to the sheriff's office, which I wasn't a part of for appropriate reasons, I think are a part of the obstacle in that regard, in addition to law enforcement being concerned that it's If it's not locked, the individual is simply going to walk away. And then if they committed additional crimes, et cetera. So that legal piece of it, I haven't been as involved in, but I think that that is a component that needs to continue to be discussed. And then, of course, there's just the professional opinion of law enforcement that that it's like, listen, if it's not a locked facility, then that would be concerning to utilize this particular option. I do want to clarify that Compass Health is the facility that does have licensure and training and certification specifically for allowing 12-hour law enforcement holds. So the provider is actually taking multiple steps to be available to this. But where the sticking point from my perspective is the concern for liability of the county and also the sheriff's office. Now, this occurred previous to our current sheriff being in place. So there certainly are some options for some additional discussion that is there, but it's not limited to the sheriff's office. Obviously, this is available to any law enforcement within Whatcom County that chose to use the 12-hour law enforcement holds. The other piece that I think is a frustration, and I'm shifting away from this 12-hour hold momentarily, is that the providers are licensed by Department of Health for specific individuals that they can admit. For example, if an individual is presenting with a primary health concern that is beyond the scope of the medical staff that are at the facility, they cannot admit them. That comes up obviously as a frustration for health professional, paramedic, et cetera, transporting an individual to the facility that, for example, we've run into has high blood pressure and does not have any blood pressure medication. The facility actually is not allowed by their licensure to admit them. They have to refer them then to the hospital to get their blood pressure, addressed and or medication on board to be able to. And then there's communication between the crisis stabilization center and the hospital in that regard. So I didn't want to limit it to the 12-hour hold. That is, I think, the frustration that the first responders have expressed, that it wasn't limited to just the 12-hour holds, but also what is an allowable admission and what is an individual that is not admittable because of licensure issues. So hopefully that's clear enough information.
I don't know, maybe I can do a little pushback and follow up, and Eric is listening. And Eric, please let us know what happens if we take him to the hospital when this facility wasn't there. We are trying to do something better and help and make it better for those people, right? And we are saying that what would be the liability for the police department or anybody if they'll take it to the hospital, drop them off at the ER, and they walk around and get back and do a crime? What is the responsibility of the prosecuting attorney's office or to the sheriff's office? What happens then? This was supposed to solve that problem.
So can you all hear me?
Sure.
Yeah, so I want to just chime in a little bit. Reliable for everything that we do. There's always a liability, and we have to, just have to be careful about the choices we make. I appreciate Perry's conversation about licensure, and I'm not sure, but I think licensure has a lot to do with what the contract is with Compass Health. And it's the people that are involved in that place. Now, could the license be different? I think so. And again, we might have to assume additional liability. We might have to assume additional risk if we want to go forward with other programs. But that's something we can choose to do. Am I wrong about that, Perry?
Well, the one thing is when we think about levels in terms of crisis stabilization type facilities, the next level up in terms of an involuntary capacity for a facility is referred to as an ENT, an evaluation and treatment facility that is licensed by Department of Health for They can go hands-on, they can restrain an individual, that sort of if needed, in those given situations. The Ann Deacon Center for Hope is not designed as a building for that to occur. And so it wouldn't be as simple as getting a different licensure for the providers at this point. They're licensed as at the highest level that they can for an involuntary facility.
Thank you, Perry. I want to respect everybody's time in this meeting and circle back to that we're trying to review the report. This is a very important conversation, and I think we do need to come back to this and see if there's other things that we can do. I know, Peter, you've had your hand up for a little while, so I don't want to not take what you have to say into consideration.
Sure. I just wanted to say, Perry did a great job of bringing this group up to speed on what the situation is at Legal and Justice Committee meeting within the last 6 weeks, I would say. There was an exchange between Perry and Steve Harris, undersheriff, and it was very enlightening. It was very interesting. It was about the 12-hour holds. Steve Harris sent out the RCW with a highlighting where the problem lies, he felt, and in reading it through, it seems like a convening problem to me. And we just need to get the right people in the room. That'd be law enforcement and prosecutor's office, a group like NAMI, perhaps, an advocacy group, and we could likely, I think, resolve some of these problems. Just this morning, I was going through the BGAT work, the gap analysis work we did during the SAC days. And so several years ago, this was on that as a problem then. And I highly recommend that we resolve this as soon as possible. Love to see it on our work plan. So thank you.
Thank
Agreed.
you for that feedback, everyone. My process will be to update the version that you have in the packet with Perry's edits and put that updated version into the packet for the full task force. If the committee here has any suggestions for either changing or removing that sentence altogether, please let me know. Otherwise, you will be able to make motions to amend the final language at the full task force. Are there any other comments or suggested edits?
Thank you, Jill. And we may be able to circle back to this at the end of going through the rest of the items, but I just wanted to make sure we would get through some of the agenda items. So, and actually, I think, is it I want to make sure I'm on the right one here, sorry. The IPRTF Communication and Public Outreach, Jenna.
Yeah, Birdie, did you want to say something first?
Oh, sorry, Birdie. You're muted.
Okay. All right. Very quickly, Jill had suggested I bring it to the attention of the committee at the start of the meeting that I have one agenda item to go under new business regarding the index committee. So that's all.
Excellent. Jenny, do you want to
Yeah,
circle back to that, and then we can add that Birdie back under number 7 with other business and new business.
sounds good. Yeah. So I was just going to talk today about the IPRTF's communication plan for the rest of the year. I believe it's been coming up quite a bit at a few meetings now that we need to start getting out more messaging about what the IPRTF has done, what they want to do. And I was thinking today that what we could do is revisit some of the work that Pyramid did for us in the past, in 2023 and before that. So look at their communications goals that they established and kind of use that as a jumping off point to talk about what communications we want to see now. And then I think the sort of the topic of the implementation plan projects and process on that, that will kind of be, it's related, but it's a little bit separate too. And maybe that's something we can talk about toward the end. But does that sound like a good workable plan for everyone? Okay. So I'm going to go ahead and just share my screen really quickly. I put together a quick PowerPoint with the information from Pyramid that they worked on last year. All right, so can everyone see my screen okay? All right.
Yes.
So the first thing, like I said, I want to do is just review Pyramid's communications goals. So they had 4 core goals for the IPRTF and their communications. The first one was to raise public consciousness of Whatcom County's work to transform its criminal, legal, and behavioral health systems. Goal 2 was to deepen understanding of what a criminal, legal, and behavioral health system grounded in community care looks like. Goal 3 is to deepen public will for the work moving forward. And goal 4 was to show how community is centered and involved in transforming the criminal legal system in Whatcom County. A lot of the work was front-loaded to the first half of 2023 last year, as they were kind of ramping up toward the ballot initiative and trying to get information out about what the Justice Project was, what was in the implementation plan. So a lot of the communications were just about telling people what was in the plan and what the projects were, and how the IPRTF provided opportunities to provide feedback on that. The communications kind of tapered off a little bit toward the second half of the year as the ballot initiative came around. And since then, since Pyramid has completed their work, the IPRTF communication has mainly been focused on just meeting updates and trying to recruit for JPOP membership. So we do need to start building up those communications again and letting the public know what work that the task force is doing, and also just keep encouraging people to engage with the JPOP when it gets started. In addition to the goals that Pyramid established last year, they also had the task force, hopefully you remember, doing a brainstorming exercise toward the end of, I think it was probably in November. And this was just to try to figure out some of the topics that we could push out and work on in 2024. A lot of people suggested that we communicate around the task force's top 3 priorities for the year. So that's something that we maybe want to nail down, is what are those core priorities for the task force that we want to be communicating to the public. We wanted to re-emphasize the task force's role in bringing innovative programs in behavioral health and diversion to the county. So what is the work that's already been done? Other people suggested that we focus on the data collection efforts and our work to measure the progress that's been made so far, and also the progress that will be made with implementation plan projects. And probably the biggest thing that kept coming up in the brainstorming exercise was the need for transparency and openness and accountability around the plan for the new jail and for the use of the new sales tax money. That in addition to the providing opportunities for additional feedback for people and for a feeling of community involvement in the process. The other 2 topics were the formation of the JPOP and updates on the 23-hour crisis relief center. And so I just bring these up to kind of highlight what we imagined our priorities would be at the end of 2023, and to kind of help us think about what they should be going into the second half of 2024 here, and see if these are still an accurate reflection of the types of topics we want to communicate about, if there are additional things that we need to start getting out, and then figuring out how to actually get those messages out as well. Okay. And this is really the last thing that I wanted to share, which is I think we need to nail down what our communications goals are for 2024. I think a lot of them remain unchanged from last year, but I think that the accountability piece is going to be huge this year, and that's something that we can start working on now. Yeah, Peter.
Well, thank you so much, Jenna, for bringing this up and reviewing it with us. You know, I just want to say that I think the state of the issue really is that the county has done such good work in its first year, meeting its first year goals, and the year is not even complete as far as the implementation plan goes, with the exception of the whole data piece. I'd say we're really doing such a good job, and we should be shouting it from the rooftops as far as I'm concerned. I know that when I'm in the community, I am asked, as one of the major public faces of this thing, I am asked constantly about how things are coming along. And it worries me that we haven't so far really communicated on around the progress that's been made, and there's so much to say. And so I'm relieved that this is coming up now. I would very much like to see some budget for doing the sort of strategic communications work that truly needs to be done. And when I am talking about strategic communications, I'm talking about this sort of work that Pyramid does, where you can figure out your messaging for your various audiences, put it within a context that they can understand, within language that they can absorb within a very short period of time, that taxpayers and voters, you know, they don't know a lot of this stuff, and like we do, they don't spend their days in meetings like these. So it's that sort of crafting of messages and focus on what it is that those audience members actually care about. And that just doesn't just happen. It happens because you have communications professionals with a strategic communications plan. And so I would highly recommend that we re-engage Pyramid if necessary to do this work, have budget to push out messages on social media, because we know that that's where people are so often getting their information. We can also do op-eds. I'd be happy to do that sort of thing. You know, it's not going to reach as many people, but there are a whole host of ways that we can communicate within a good, well-conceived structure. And so I think this is an excellent beginning. I highly recommend we do this in the near term. So thanks.
Thank you, Peter. Thank you, Jenna. This is kind of jumping ahead to item number 6 on the agenda, but I think that this is something the whole task force might want to weigh in on how we want to communicate and what we want to communicate moving forward. So, I mean, that's just my thoughts. I think you did really well with that presentation. I think yesterday's meeting with the joint task force between behavioral health and legal and justice, Heather brought up a presentation of 6 items. That might be something that could also be shared if that's something that the whole task force wants to look at on implementing for seeing if those are some of the goals that we want to share. So those are just a few thoughts on what you brought out, but thank you. And I see Jill's hand is up.
Thank you. I just wanted to say something about that, going back to the annual report right quick when we're done with this item.
Any other questions or thoughts on Jenna's report? All right, we're going to jump back to Jill.
Thank you, everyone. Executive Seduce suggested some alternative language for that sentence that was being discussed earlier. I just forwarded it to you. It says Whatcom County Fire Chiefs would like to see some policy or procedural changes at the facility before they can adjust their protocols for first responders. If that is language that is acceptable to the committee here, I can make that substitution before putting it in to the final packet for the full task force. Is that all right with the committee?
I'm supportive with that, Jill. I think just a more, elaborate and accurate statement.
Thank you. Is there anyone opposed to that? Great. All right, thank you.
All right. I think we are on to Barry Buchanan. If you want to speak on the Justice Project implementation plan, or if there is somebody else that wants to try to help out Barry.
Well, I just had a big dental procedure started, whole treatment started yesterday, so I'm not going to talk. It's very difficult. I'm on horse pills the size of like a small boat, and they're kind of kicking my butt too. But anyway, if someone else could take that, I would be really appreciated. Maybe something from the executive's office. Is there some kind of an update we could get maybe out of what the work that's going on the facility side? Because I'm not aware of what's, kind of where we are. So that would be helpful for me. Thank you.
I can give some information. Kayla was busy with something else, and so otherwise we could have given her some more details. But let me share with you that we did accomplish one of the major thing was the jail use agreement, which you guys all know that all these city councils have approved unanimously, and we have done that task. We are starting to have meetings with some of the jail consultants. We're not committing to anybody. 2 or 3 different bodies have come. Of course, many of us went to Columbus, and yesterday we had a 2-hour meeting with HDR. HDR is the jail building company who built that jail in Columbus, and they had done Whatcom County jail design in 2017 also. So their brass or top people were here, and they showed us a lot of different, they have built over 200 jails in our nation. So they had a lot of different alternates and things, and which was very helpful. We have asked them to prepare a concise 3 to 5 page report for what Whatcom County needs are, what is our budget, and what we are looking for. And I think once we receive that, we'll share with everybody. That's just like step number 1. We have hired a project manager in the facilities who will be the project manager for the Justice Project. We are, one of the things we are trying to develop is our meeting schedule. I think that you have heard from Kayla only on the IPRTF side, but on the facility side, I met with Peter a couple of weeks ago, and same thing, but Jenna just brought in how do we inform public what is going on the implementation plan? It's important, and people want to know. And I think that before we jump on to those kind of things, we need a little bit time to start from the apex. To me, just to share with you that the county council, IPRTF, executive's office, sheriff's office are the key people about the jail design profile, what we starting with. And of course, public is part of that as well. So we put a circle around the public as well, that what we do, how do we inform public about it? We are, for example, we are proposing we can give council a quarterly update, and other things that may not be quarterly, maybe a little bit more bi-monthly or monthly updates, what we are doing, because the meetings take up so much time, and the directions change in meeting, because in certain day we are thinking certain way, what about this? And then attention goes towards that. We wanted to keep it a little bit nimble and informative and decision-taking type of thing. And then the next step comes in actual, I'm right now looking only on the construction side, because behavioral side, of course, it is important. And that's why I would like IPRTF to take that charge a little bit and work with the executive's office and us, and see what are the things like 23-hour facility, what is the progress going on that. But I think we at executive's office need to concentrate on the construction side. This is the first time our county has taken such a large project in a short window of time of 4 years. My learnings from my experience has been, if the first 18 months of this project, we are able to control the project and put the directions on and put it on the rails, the next 18 months will be very easier. If we lose sight of the project in the first 18 months, we will never catch up with this. It is such a humongous, multi-directional, multi-millions of dollars commitments. You can't make commitment and 6 months later, oh no, by the way, we wanted to do this, not this, right? It becomes very difficult on this. And this is not a private company project where there are 5-7 people who make the decision and keep going. Our organizations are not like that. We have involvement of multiple bodies, council, as well as the other outside events happen. Suppose, the whatever emergencies come, attentions come to the council's attention or to the executive's office. We get busy in certain things. We have to take into account all these things and keep moving forward on this thing. So believe me, this is the only thing I'm doing these days is the construction, making a organization for the construction of this project. And setting a protocol which we can share so that everybody understand, not only IPRTF, the council, the facilities department, prosecutors department, their involvement into where they are needed. And of course, sheriff's department is very much involved in that. So we believe that next 4 weeks or so, we will have something which we can share. At the same time, we have an overall schedule. I had in the last meeting yesterday, they asked, what is your timeline? So I gave them 4th of July, 2028, we want to have the ribbon cutting ceremony on the jail. So I'm committing myself to certain hard deadlines. Right? We have to start with that. Because then we have to work backwards. Okay, if that's what it is, and these people are going to work backwards from that date, that what is possible and what are the hurdles, so that if we know ahead of time how to solve these hurdles. So, so on the implementation plan, the 18 strategies, we are very much aware of that. We have to form a process where each of these strategies are looked at in a sequential way as the project progresses, so we can report back to all these entities I mentioned, including the public. So on the strategy 1, 2, 3, 4, this is what is done. This is what is, we are not working on this. We are not working on this, but we are working on these, so that we are transparent and we are showing where we are making the firm commitments. So that's it. It's a little bit up in the air type of report I'm giving you, but that's where we are. It is being tossed around and being worked on so that we can have some kind of firm plan.
Well, thanks, Paul. That was actually a pretty darn good report. There were some things in there I didn't know, so thank you.
Thank you.
Questions for Paul?
Yeah. Or any ideas, please. If you have ideas, not today in the meeting, otherwise, please share with our office. Let us know that, hey, what about this? What you will not be bothering us. I've been telling you, if you send me 3 extra emails, that will be fine. We'll let you know when you are real
Thank you,
pestering.
Peter, and
But
then
until then, let us know.
Oh, Sat Paul, thank you so much for the report. I guess my suggestion would be coming out of a experience I had last week where I was asked to give an update on progress on the Justice Project implementation plan to a group of folks who are providers and health department folks involved in reentry. And I was able to get my hands on a presentation that Kayla gave to the city council, I believe it was, from a month before. And thank goodness I had that. So I had something to work from. But I think it would save Kayla and others in your office a great deal of time if there was a kind of running, it doesn't have to be a report that you necessarily give every month or even 2 months. It's a running list of where you are in the process with the timelines. And I can tell you what sort of questions pretty easily, tell you what sort of questions I'm hearing in the public. What are people worried about? What are they concerned about? What's going to help them know that you and your folks here at the county are doing a good job. So it's something that we can save Kayla a lot of time. If it's always there, something we can grab for presentations, or if we're going to a meeting or communicating with somebody. Doesn't necessarily have to be public facing, though that would be best. But, you know, I think there are plenty of ways that we can do this that so you're not having to continually give a report.
Thank you. I think that's a great idea. Maybe some kind of internal internal newsletter of sorts, and or a Justice Project update type of which goes to certain people at a frequency. Yeah, that's a great suggestion, and we'll work on that. And same thing with the meetings also. We want to sort out that we have just enough meetings so that everybody's informed, but at the same time, not tax ourselves with meetings and meetings and meetings. So we are trying to find some medium way spot to do that. Thank you.
I support you in that. That's great.
Thank you.
thank you, Dan, and then Jill.
Yeah, just real quick, one comment and one question. So it'd be helpful to have some kind of presentation to Bellingham City Council at some point later, maybe in the summer, late summer, early fall, just to update both the council and the mayor and the public on the Bellingham City side. And then question, you mentioned executive, you mentioned HDR. Are they a finalist? Are they the preferred vendor, or do you still have an RFP out for that, for the design and build?
No, let me share with you. As people have seen, our ballot has passed, and these people have scouters who are scouting all these things, and they've been calling us, hey, I'm in this business. Can I tell you what kind of wares I have? That's it. Unsolicited. We have not. We are actually a little bit selective. We don't want everybody coming, taking 2-3 hours of our staff, everybody else, to do that. And we are gathering in the information from Columbus as well. Caleb is putting a shorter document together from all the comments and videos and all the things we have gathered. And we have a couple of new visits I'm planning for San Diego, and maybe going back to Nashville again. Like this will not be 18 people, but smaller group of people. And there was another county up in Texas, I believe these people shared. They said, why don't you? And that was a similar size county, similar size facility, what we are expecting. So I'm asking sheriff and facilities, maybe 2 or 3 people go there. So we are still in the gathering phase, but we are not, nobody is on that. We have to first start back. The first step we are going to do is we are going to hire a owner's representative. It will be like a architect engineering company who will work on our behalf. They will be our face to the actual people who will be actually bidding for us, because the details are so intricate and the contracts are so complex that we don't have that expertise. So they will be looking after our interest when they give us a bid document, or developing the specifications for the project, specification for the materials, right? Because there's a lot of things which are hidden in there and hidden in the cost of those. They will say, oh, you picked this thing, right? And though we are basing everything on that, what you decided, I don't want to decide those things until I have somebody. My experience is 20 years old, so everything is changed from that time. The methods of construction, the materials being proposed, and other specifications being proposed. So we are looking for one of theirs to work for us so that they can keep them honest. So that is the first preparation we'll do. Once we do that, then we'll put a RFQ out, request for qualifications, where people will say, then we will pick few people out of that who are qualified, and then we'll go for that. If we have a few more minutes, because I have to get on to EOB meeting, but I'll share more that how we are planning to do. I run out of time. Sorry. Sorry, I have to go to the EOB meetings.
Thank you. Thanks.
Thank you, Paul.
Thank you.
Speaking of
Yeah.
meetings upon meetings,
Yeah.
I have another one that I also have to leave for. So I'm going to turn this over to Peter to, if there's anything more on the J-pop, otherwise it would be items for the next task force agenda. And then when you get to other business, go back to Bertie. Thank you.
Okay, so I guess I'm chairing this meeting all of a sudden. I don't have an agenda in front of me. Can somebody put that up on the screen, Jenna, perhaps?
I will just say that the next agenda item is the items for the June task force meeting, and I have that, the draft agenda
Okay.
is, first of all, the annual report. And then it's going to be a big meeting. We've got a number of presentations scheduled. The first from Mayor Lund on her executive order addressing the fentanyl crisis in downtown Bellingham. A presentation from Kayla on identifying Whatcom County's approaches to the fentanyl emergency. And a presentation from Perry and Erica on the MAC group recommendations. In addition to those, Kayla is also going to give an update to the full task force on the financing agreement for the Justice Project with the cities. And Jed wanted to talk about the agenda for the meeting as well. Jed, you want to talk about your plans?
Yeah, I think as some of you are aware, we're expecting a delegation from Spokane that's interested in our experience with the Justice Project and ballot measure. They're visiting Sunday, Monday, Tuesday. They saw on the calendar that the task force is meeting, and I think they just want to learn more. I don't know if they want to ask you questions or what their participation would look like and what the value it would bring to the task force, or like I know Jill was saying, the time crunch. They're coming all the way from Spokane to participate in the Zoom meeting, right? A little weird that is, but they're also touring different places and talking and having dinners and all that. So I wanted to put that request out there that they thought that if there was 10-15 minutes in the agenda for an interaction with the task force, that would be great. And so I'm bringing that to you.
It sounds like we definitely have a full meeting agenda. I want to be as gracious with Spokane as Franklin County and Davidson County have been with us, certainly. So if we can give them some time in a meaningful way, it seems like that would be a good idea. I'd be in full support of that. Perry, what are you thinking?
It was actually in relation to just a clarification of what Jill had shared, that I'd been in communication with Director Lautenbach, and she wanted to be able to present an operations plan relative to Whatcom Health and Community Services that's connected to the fentanyl executive order, was, specifically what that has been put together by the MAC group, I think in part, and other entities. She was in communication also with Kayla, wanting to make sure that there wasn't repetitive information, but determining in terms of who the presenter on that would be, either Ms. Lautenbach or Kayla herself. So just to clarify, for Ms. Lautenbach's request was in terms of a presentation of the operations plan, Whatcom County Health and Community Services for the fentanyl executive order. Thanks.
Jill,
I can combine those two as one agenda item and put both Erica and Kayla as presenters, if you like.
Before we go to Bertie, Jill, looking at that list, in your estimation, do we have 10 minutes or 15 minutes for the folks from Spokane?
I really can't say because I don't have any information on how long Mayor Lund's presentation is. Dan, do you have any insight on what that might look like? Dan Hamill?
Oh, sorry. You kind of cut out there just for a second. I don't know. I can check in with the mayor and find out. She'll tailor it to whatever the needs are. So, and I would also add that the Bellingham City Council at the last meeting passed a resolution declaring fentanyl and synthetic drugs as a public health crisis. So if we can manage to put that in there, I can literally report on that in probably 1 minute or less.
Can you report on that after the mayor gives her presentation?
Sure, I'm happy to do that.
We'll just roll that in there.
Yeah, I think it's important that we show that there's parity between the county, the city. LABC also passed theirs. So I think it's important that we show that policymakers are standing united with our executives on this issue.
Very good. Bertie? You're muted.
Okay, I was going to say I'm somewhat excited about this agenda in the sense that sounds like the task force is going to be focusing on all the different areas of our community's response to the fentanyl crisis. And I was wondering, in the limited time left, if there's anything we wanted to suggest to the task force that they read about in particular that would be somewhat concise and help them be more informed, or if there were any particular questions we wanted them to hear the presentation in the context of that we could then discuss later. It just feels to me like the whole response to the fentanyl crisis is such a big part of all the areas that the IPRTF touches in every area. It would be nice if we could find a way to use all the information we're going to gain at this meeting to then guide some productive thought moving forward. So that's my suggestion. I don't have anything specific to recommend at this moment, but I think we have an opportunity if we could focus it a bit prior to the meeting.
I've got a quick follow-up on the Spokane folks. I could just offer them the opportunity to join and observe the meeting, right? And then indirectly after, in an informal, they could, you know, reach out and have interactions with, you know, all the members, as opposed to taking up some of the meeting time, right? Because they're going to be in the area and we'll have that opportunity. I'm not getting a sense that the actual meeting would be the right place to do that. So that's something I'd be happy to bring back to them and see how that lands.
Hey, Jen, you can,
Jen, what
you
are
can-
the
Good.
what's their schedule like with them? Are they going to have plenty of access to all the members of the IPRTF in person or in other meetings?
Yeah, there's going to be a broad invite for dinner on Sunday night for informal interaction. I think
Okay.
we're hoping to have a visit out to the Crisis Stabilization Center. They might get to experience a little bit of the all hands event on Tuesday. It's still kind of up in the air. So one of on their wish list was to participate in this meeting, and I'm not getting a sense of what that participation would look like, apart from
Okay.
observing and maybe
One of
asking
the-
questions about how the committee or the task force came about. So
One of the things that I can do, if you like, Peter and Heather, is schedule it at the end of the agenda and just make a notation that it's tentative if time allows. So at least they're on the agenda and folks are aware that they'll be attending and they can get an invite, et cetera, et cetera. Heather's-
I like that idea, and I just want to make sure that we're doing everything we can to answer any questions that they have, even if it is after the meeting offline. I love the idea of their participating. I've been following the Spokane situation. They have not done what Whatcom County has done over the last 7 years since the failure of 2015 and 2017, all the work that we did in preparation for the third attempt at the levy. And so they need to see what it looks like to do the do this hard work. So I love giving them that look into what it is that we're doing, and then opportunities to follow up. And Dan, I'm afraid I cut you off. What was
No,
it
it's
that
fine.
you
It's
wanted to
fine.
say?
No, I just, Jed and Jill, I just wanted to provide myself as a resource to, if they want to discuss some of the programs that have been developed out of the task force, Grace Lead, alternate response team, you know, the electronic home detention. I'm happy to do that, to set aside like an hour or whatever of that day in the afternoon, or those days, whatever's appropriate. So but I just want to offer myself up as a resource.
appreciate that.
Yep.
Jen, do you have a head count on how many folks there will be?
15-ish, you know, but it does include, I think, the mayor of Spokane and the chair of the council, and some, you know, some of the top leaders, as well as some folks who are in the working with foundations and nonprofits and behavioral health providers and all that. So it's a broad spectrum.
Okay, Great, thank you.
And Jed, are we going to hear more about opportunities to interact with these folks?
Yeah, before the end of this week, we should have an agenda put together, and I think I sent out something probably about 2 weeks ago saying, just keep in mind that this is coming, so.
Okay, great, excellent, thank you.
Jed, I don't know if I saw that, and I'm not sure that I caught that there was some interest in the Crisis Stabilization Center and possibly a tour.
I'll reach out. Barry.
Okay, I know that you and I have communicated before, so I'm available.
Yeah, I appreciate that, as always.
Hey, Jed, what are the dates on that again?
23rd, 24th, and 25th.
Okay, thank you.
So I
No,
will
what's-
schedule the agenda as discussed and not include our normal committee updates. I can include paperwork for that and also not include the Justice Project implementation plan that's scheduled on every agenda. So I think that's the direction I need for finalizing the agenda. Thank you, everyone.
Great, and maybe if it looks really tight, maybe we can send out time expectations to our presenters. That'd be good. Jill, what's the next thing on our agenda?
I'm sorry, you cut out there for a second. What was your question?
What is I'm sorry, what is the next thing on our agenda today?
Other business.
Oh, Bertie, you have other business.
Yes, thank you. I want to circle back briefly to the Index Committee. As you know, at the last meeting, I presented the desire of the Index Committee to divide into 2 work groups, and that was discussed. And I had the sense from this committee that it was really not a significant change from the original structure, and therefore it did not need to, nor did it go to the IPRTF last month. So the Index Committee has had another meeting, and the reason I'm bringing it here is because as chair, I'm really ready to get the work groups going, and we're running into confusion about the roles of all the various players in the data. And so I would like some clarity out of this group. We have Kayla Schott-Bressler came to our meeting, and her comment was, but this is the role of the JPOP committee. And when I look at the charge to the JPOP committee, she's really quite right. The JPOP committee is supposed to, its first step is to develop all the metrics and da-da-da-da-da-da that reads very much like our charge to the Index Committee. And after some discussion, she was more than willing to listen to what our work group might produce. But I think there's so many people involved, and I feel some urgency to get traction on getting some data actually out and available to the public. That was one of our stated goals for 2024. So I guess what I'm asking for is clarity. My request is that we go ahead, put together our 2 work groups, starting particularly with the policy one. We may want to actually hire a consultant, possibly use Western Washington University in some fashion, and that will take time to cycle through all the things necessary to get a contract approved through the county. I don't in any way want to run over the JPOP committee, but I think I see them more as an advisory role. And it's, we have the advisory role of them, and then IPRTF is on top of JPOP. So obviously there's some clarity to get. I'm really looking for support and essentially permission to move forward with getting the work group started, not to block out JPOP, but to get some traction from the experts that we can then include JPOP in the review of.
Bertie, thanks for bringing that to us today. I have a couple remarks before we go to other comments. None of us know what it's going to be like to have JPOP, IPRTF, and all its committees all going at the same time, covering similar territory as well as MAC groups. I mean, it's a whole new ball game, and we're gonna have to figure it out. And Kayla has not had time yet to present to us a kind of a slimming mechanism that she's suggesting for all these committees. It's something of great import. I am totally with you on my understanding of J-pop, it's a large group. It's a
Right.
very large group, and its charter is huge. We have specific, when I say we IPRTF folks have specific committees that can work on specific things, and J-pop isn't going to be like that. So I do believe that unless I hear some amazing argument from Kayla, I think that we really need to move forward with the work and the index committee and the other committees. What do other folks on this call, how do they feel? Any advice for Birdie?
Bertie, can you just restate the kind of primary issue that you're trying to deal with here?
Yes, certainly. I'm trying to get a small work group, which would be a subset of the index committee and report back to the index committee, to really get down and dirty and have the experts in the field that will help us decide the data priorities. What will be the first data that we request the executive's office to produce? And then what is the most important program evaluations we want to do, and what is the appropriate data to evaluate it? When I talk with folks at the health department, and from my own past experience in healthcare, I'm no expert, but what I do know is there is definitely a wisdom and an expertise in what the data is that is used to do effective program evaluation. And so I want those folks involved early so that we really have a robust plan around our data needs over the next several years. The IT work group is poised to get going with that. And I think we have to start first is what are we looking for, and then how can we do it?
Okay, thank you for clarifying. So I think there's two ways we can approach this, generally speaking, and this is just my opinion. I could be completely wrong here, but one thing that we've talked about is the importance of having line professionals on our various subcommittees and existing in the task force, and we are starting to rebuild that to some degree. We keep losing people because they rotate out due to changing jobs or retirement or what have you. So there's that piece. That would be the ongoing expertise. When you say experts in the field, that's, makes me think of folks like that. And then the other piece is, we could be actively inviting folks that work in various sectors of healthcare, whether it be behavioral health or physical health or mental health or whatever the case may be, to come and provide that important testimony and those data points. So I think I see those as kind of the two general areas where we could be improving the work that we do by including those voices in the conversations that we're having.
Dan, we have an excellent opportunity as Birdie has laid this out, two work groups, one being a technical work group with the folks in IT and with in the health department who are doing this type of work, and then it's separately a policy work group, and bringing folks in from all sectors to figure out what it is that we want to know, how it is that we ascertain whether our programs are working to do what it is that we expect them to do to incarcerate, reduce and prevent incarceration. So I think we have a great opportunity there.
And my plan for the policy work group is to really combine what you were mentioning, Dan, and get some experts in the field, and then also folks with the behavioral health and other knowledge. And we may have a small work group that then invites people in for their opinions. You know, I think we will learn as we go, but the value is being a small work group, and I'm anxious to involve Western Washington University if possible. I know Sheriff Tanksley has mentioned that he would like to, and he would be one of the first people I would invite to be on the work group. So I also did get a follow-up email from Kayla Schott-Bressler after the meeting saying that she would be very willing to rely on the index committee and requesting that we come up with a list of goals and a draft scope of work for the next couple of years that she could bite into in her executive role to facilitate getting that data. So I think from the discussion, we've ended up pretty much on the same page, assuring that we are not in any way running into issues either perceived or otherwise with the JPOP.
I just want to bring up one point here, and just how important this is. And it's going to be approaching us very, very soon. So I know that Franklin County, where we visited recently, they did and they hired consultants, same consultants apparently we're looking at, to do a size assessment for our jail. And as you know, this is a critical issue. It's going to affect our build cost. It's going to affect the way we do our run our jail, etc. And those people, to do their work, it's completely data driven, and we need to be prepared to be able to deliver the data to them so that they can make that assessment. And I have no confidence right now that we're going to be able to do that at this moment if they asked us. So I think moving quickly towards finding out what that data is, and for this group to be focusing on that perhaps first, would be a grand plan, because that moment is on the horizon.
Hey, Peter, if I can just follow up real quick with Bertie, with your comment about Western. Absolutely completely underutilized partner / resource, and if we could get them in the fold here, that would be super helpful. And then I would add two others. Swinomish Tribe has been super excellent partner, and we'll have some news regarding them coming up. And then Lummi Nation has been they hosted a convening of tribes across Washington State last year, and I think that they would be an excellent partner in being able to provide data resources that might help kind of get you to the goals that you're thinking about.
Thank you. Good thought. Appreciate it.
All right, and Jed.
I've got to run. I wanted to say thanks for the time today.
And thank you for joining us. Really appreciate it. Okay, we've got 4 minutes left. I want to see if we have any public comment.
Thank
Jill,
you.
do I have any guesses?
Yeah, our only person in our attendee room is Prosecutor Ritchie, and you are already empowered to speak if you like. Peter, do you have anyone in the conference room?
I'm here all by myself.
Okay, so it doesn't look like we have any guests attending today.
Okay, very good. All right, and with that, we will close the meeting for 6/12/2024 steering committee meeting of the IPRTF. Thank you, everybody, for joining us today, and I look forward